Dear esteemed readers, arthritis is a very common chronic condition among older adults, especially those between the ages of 60 and 80. It does far more than simply cause persistent aches and pains. It can lead to a host of serious consequences if not identified and treated promptly. In the earliest stages, you might notice only a bit of morning stiffness, but if left unaddressed, this can progress to relentless pain, redness, swelling, and a restricted range of motion. Everyday activities like walking, sitting, and standing become difficult, and in the worst cases, joints can deform or even become incapacitated. Beyond the physical discomfort, long-term pain takes a heavy toll on mental well-being. Sleep disturbances, loss of appetite, stress, anxiety, or depression can follow, all while medical costs mount for both the individual and their family. The roots of arthritis are many and varied, but several key factors stand out. First is the natural aging process. Over time, the cartilage cells that cushion our joints lose their ability to regenerate, and the joint fluid that lubricates and nourishes them gradually thins. This increases friction and accelerates wear and tear on the cartilage. Carrying excess weight compounds the problem. Every extra kilogram of body weight translates into roughly 4 kilograms of pressure on the knees with each step. And adipose tissue itself releases inflammatory substances that hasten cartilage breakdown. Genetics also plays a significant role. If close relatives developed arthritis early, your own risk is higher. In women, the postmenopausal drop in estrogen further weakens bones and cartilage. Unhealthy habits, such as a sedentary lifestyle, prolonged sitting, lifting heavy objects improperly, smoking, and excessive alcohol use, place additional strain on joints and fuel chronic inflammation. Finally, an imbalanced diet lacking adequate protein, calcium, and vitamin D leaves joints starved of essential nutrients, while high intake of refined sugars, processed foods, and repeatedly heated cooking oils triggers oxidative damage that undermines joint integrity. Those with a history of gout face yet another layer of risk. Purine-rich foods like red meat, seafood, and alcohol lead to uric acid buildup and recurrent flare-ups. To control symptoms and prevent further progression, a comprehensive approach is essential. Begin by adopting regular, moderate exercise. Brisk walking, swimming, or stationary cycling for 30 to 45 minutes most days of the week promotes joint lubrication and nourishes cartilage cells. Supplement these with gentle strength-building exercises, light squats, yoga, or Pilates to stabilize and increase flexibility, and never skip a proper warm-up and cool-down to reduce injury risk. Weight management is equally critical. Losing just 5 to 10% of body weight can decrease knee joint load by up to 40%, offering significant pain relief. Aim for a modest calorie deficit while ensuring adequate nutrition. Focus on plenty of vegetables, fresh fruit, whole grains, and lean proteins such as skinless poultry, fish, legumes, and nuts. Incorporate anti-inflammatory foods rich in omega-3 fatty acids, salmon, mackerel, flax seeds, chia seeds, and antioxidants, berries, pomegranates, dark leafy greens, and use natural spices like turmeric, ginger, and garlic to help combat inflammation. Equally important is avoiding refined sugars, heavily processed foods, and repeatedly heated oils, all of which silently erode cartilage health. When symptoms worsen, medical intervention becomes necessary. A healthcare provider can recommend non-steroidal anti-inflammatory drugs, AIDs, for pain relief, disease-modifying anti-rheumatic drugs, DMARDs, for rheumatoid arthritis, or intra-articular corticosteroid injections during acute flares. Physical therapies, such as shockwave treatment, therapeutic laser, or ultrasound, can improve blood flow and alleviate pain. In advanced cases, minimally invasive arthroscopy or total joint replacement may be the best way to restore function. Home care also plays a vital role. Applying warm compresses in the morning can ease stiffness, while cold packs during flare-ups help reduce swelling. Using supportive devices, canes, braces, or cushioned insoles can offload stress on vulnerable joints. Alternating periods of rest with gentle movement prevents overload and maintains joint health. Equally important is psychological support. Chronic pain often leads to emotional distress, so practices like meditation, relaxation techniques, or participation in support groups can lift spirits, reduce anxiety, and keep motivation high throughout treatment. To track progress and ward off relapses, schedule joint evaluations, including clinical exams and blood tests for inflammation markers, kidney and liver function, and uric acid levels every 6-12 months. At the first sign of new pain or swelling, early consultation with your healthcare provider can minimize permanent damage. Thank you for taking the time to read this article. While arthritis is a chronic condition that cannot be completely cured, a balanced blend of lifestyle changes, proper nutrition, and timely medical care can significantly reduce pain, preserve mobility, and improve quality of life. Wishing you strength, optimism, and independence every day.